Ever wondered why arthritis causes so much discomfort and pain? Well, let's unravel this together. Arthritis, a term you've probably heard before, is not just one disease. It's an umbrella term that encompasses over 100 different conditions. Today we're focusing on three common types: rheumatoid arthritis, osteoarthritis, and gout. Rheumatoid arthritis, an autoimmune disease, is when your body's defense system attacks your own joints, causing inflammation. Osteoarthritis, on the other hand, is a degenerative joint disease where the cartilage that cushions your joints wears away over time. And gout? It's a form of arthritis caused by excess uric acid in the bloodstream, leading to severe joint pain. These types of arthritis can significantly impact a person's life, causing discomfort, pain, and sometimes even disability. This is why understanding the pharmacotherapy of these diseases is so important. By understanding the pharmacotherapy of these diseases, we can better manage the symptoms and improve the quality of life. Starting off with rheumatoid arthritis, a chronic inflammatory disorder. This condition affects more than just your joints. It can also damage a variety of body systems, including the skin, eyes, lungs, heart, and blood vessels. Rheumatoid arthritis is an autoimmune disorder, which means it occurs when your immune system mistakenly attacks your own body's tissues. When we look at the symptoms, they can vary in severity and may come and go. Periods of increased disease activity, called flares, alternate with periods of relative remission, when the swelling and pain fade or disappear. However, over time, rheumatoid arthritis can cause joints to deform and shift out of place. Now let's delve into the pharmacotherapy of rheumatoid arthritis. It's a multifaceted approach, focusing not just on the symptoms, but also on slowing disease progression. The first line of treatment involves disease-modifying anti-rheumatic drugs, or DMARDs, which can slow the progression of the disease and save the joints and other tissues from permanent damage. Common DMARDs include methotrexate and hydroxychloroquine. Alongside DMARDs, non-steroidal anti-inflammatory drugs, or NSAIDs, are used to control pain and inflammation. These include drugs like ibuprofen and naproxen sodium. However, NSAIDs can cause side effects like stomach irritation, cardiovascular problems, and liver and kidney damage, so they should be used cautiously. Corticosteroids like prednisone are potent inflammation fighters. They can quickly control the inflammatory symptoms of rheumatoid arthritis and are usually used in short-term situations to get flares under control. It's crucial to remember that while these medications can control the symptoms and slow the progression, they can't cure rheumatoid arthritis. Furthermore, they all come with potential side effects, so it's always a balance between managing the disease and minimizing the side effects. However, with the guidance of a healthcare professional and an individualized treatment plan, effective pharmacotherapy can significantly slow down the progression of rheumatoid arthritis and manage the symptoms. Moving on to osteoarthritis, the most common form of arthritis. This condition is characterized by the wear and tear of joint cartilage, the hard, slick coating on the ends of bones. When this cartilage wears down, bones rub together, causing pain, swelling, and stiffness. Over time, joints may lose strength and pain may become chronic. Unlike rheumatoid arthritis, an autoimmune disorder, osteoarthritis is a degenerative joint disease. It is often associated with aging, but it can also be triggered by joint injuries or obesity. Symptoms typically begin on one side of the body and may progress to the other side, unlike rheumatoid arthritis, which typically affects the same joints on both sides of the body. Now let's dive into how we can manage osteoarthritis. The goal of pharmacotherapy is to alleviate pain and improve function. Over-the-counter non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen and naproxen, or prescription NSAIDs such as celecoxib, are frequently used. They work by reducing inflammation and relieving pain. Analgesics or pain relievers like acetaminophen may also be used. However, NSAIDs are generally more effective as they target inflammation, a key factor in osteoarthritis pain. Topical NSAIDs and capsaicin cream may also bring relief to aching joints, particularly in the hands and knees. For severe cases, opioids may be prescribed, but they are usually a last resort due to their potential for dependency and side effects. Corticosteroid injections can provide temporary relief for severe pain. They are injected directly into the affected joints to reduce inflammation. Lastly, when pharmacotherapy and lifestyle changes are not enough, joint replacement surgery may be considered. This involves replacing the damaged joint with an artificial one. While osteoarthritis can't be reversed, pharmacotherapy can help manage the symptoms and slow down the progression. Next up is gout, a form of inflammatory arthritis. Now, this isn't your everyday joint pain. Gout is notorious for its sudden, severe attacks of pain, redness, and tenderness, often striking at the base of the big toe. A real wake-up call in the middle of the night. So what's the culprit behind this nocturnal nuisance? Meet uric acid, a byproduct of the body's natural breakdown of purines, which are found in many foods we consume. In gout, an overabundance of this uric acid forms sharp needle-like crystals in the joint, resulting in intense pain and inflammation. Now that we've met the villain, let's talk about our heroes, the pharmacotherapy options for gout. First in line are non-steroidal anti-inflammatory drugs, or NSAIDs. These drugs are often the go-to for treating acute gout attacks, offering relief by reducing inflammation and pain. For those who can't take NSAIDs, corticosteroids are another option. They can be taken orally or injected directly into the affected joint to quickly control inflammation and pain. But remember, while these drugs can tame the pain, they can't reduce uric acid levels. So, how do we combat those pesky uric acid crystals? Enter drugs like allopurinol and febuxostat. They are uric acid-lowering medications often used for long-term control of gout. They help keep uric acid production in check, preventing future attacks and reducing the risk of gout complications. But like all heroes, these drugs have their weaknesses. They can cause side effects like rash, nausea, and liver problems. So it's crucial to discuss these potential side effects with your healthcare provider. And there you have it, a rundown on gout and its pharmacotherapy. It's not just about managing the pain, but also keeping those uric acid levels in check to prevent future attacks. While gout attacks can be extremely painful, proper pharmacotherapy can prevent future attacks and reduce the risk of complications. Beyond medications, lifestyle changes also play a crucial role in managing arthritis. Now let's delve into the 3 significant lifestyle modifications that can complement pharmacotherapy and help manage arthritis symptoms. First up is diet. It's no secret that what we eat impacts our overall health, and arthritis is no exception. A balanced diet rich in fruits, vegetables, lean proteins, and whole grains can help reduce inflammation in the body, a primary characteristic of arthritis. Foods high in omega-3 fatty acids, such as fish and flax seeds, are particularly beneficial as they have anti-inflammatory properties. On the flip side, try to limit processed foods and those high in saturated fats, which can increase inflammation. Next, let's talk about exercise. You might think that arthritis and exercise don't mix, but contrary to popular belief, regular physical activity can help reduce arthritis-related pain and stiffness. The key is to choose low-impact exercises like swimming or cycling that are easy on the joints. Strength training can also be beneficial as it helps to strengthen the muscles around the joints, providing them with better support. Of course, it's always best to consult with a professional before starting a new exercise regimen. Lastly, we have weight management. Carrying extra weight puts additional pressure on your joints, especially the knees and hips, which can exacerbate arthritis symptoms. By maintaining a healthy weight, you can reduce this pressure and thus the pain and discomfort associated with arthritis. A combination of a balanced diet and regular exercise is the best approach to weight management. Adding these lifestyle changes to your routine may not be easy, but trust me, the payoff is worth it. Not only can they help manage your arthritis symptoms, but they can also improve your overall health and well-being. Remember, pharmacotherapy is just one piece of the puzzle. A healthy lifestyle is equally important in managing arthritis. So take that step towards a healthier you today. It's never too late to start. Arthritis can be a challenging disease to live with, but understanding its pharmacotherapy can make a world of difference. We've journeyed through the medical landscape of rheumatoid arthritis, osteoarthritis, and gout, exploring the therapeutic options available. From immunosuppressants and steroids for rheumatoid arthritis to NSAIDs and corticosteroids for osteoarthritis, as well as colchicine and allopurinol for gout, we've seen how these medications can help manage these conditions and improve quality of life. But remember, these are not one-size-fits-all solutions. Each patient's journey is unique, and treatment should be tailored to their specific needs and circumstances. Beyond pharmacotherapy, we also highlighted the critical role of lifestyle changes, emphasizing the importance of a balanced diet, regular exercise, and stress management in managing these conditions. Understanding these complexities is key to navigating the world of arthritis management. Subscribe for more because you won't find me later. Together, we can unravel the complexities of medical science.